Hey, good afternoon. My name is David Stead. Today I wanted to present my video of my research paper and what I decided to write about. And so my title was Parental Involvement in Structured Autism Therapy and Its Impact on Social Development in Children with Autism Spectrum Disorder. I basically chose this to write about because I was a single parent to my son after he was 2 years old. So raising a child, now he's 12, so the past 10 years, for most of it being a single parent, was tough, right? It had its challenges. My son does not have ASD, autism spectrum disorder, but I wanted to understand more about it and the struggles, what supports out there, struggles parents have to go with. And had my son had ASD, kind of what goes on there, what I would actually have to struggle with, and how hard it would be, just let alone being a single parent of a child, is tough. And that's kind of what I wanted to learn more about. and this kind of topic focuses on how parenting influence therapy outcomes, and why their role is critical beyond just the clinical setting. So not only, is there a benefit? Is there a benefit for the home, for the parent, and if the parent's involved, if they're trained, why is that better? Is clinical setting better, or both? Right? If you have both there. So introduction, kind of this. What's ASD? Right? So autism spectrum disorder, ASD, a development condition, primary effects, communication, social interactions, and emotional regulations for children when they're diagnosed, and them creating relationships with others, and can be tough, right? So they often struggle with understanding emotions, forming relationships with others, and communicating effectively. So the things that they struggle with. So there are therapies that are out there. You've got applied behavior analysis, you have speech therapy, occupational therapy are commonly used. And it's just a part of, what else is out there for the child in an environment, which is important, especially at home. So parents, however, interact with their children daily. This makes one of the most influential. You got to think, like, if it's at a therapy setting, school setting, government program, whatever they're at, but the majority of the time the child's at home. So that's the influential factor there, for child's development. Is at home. So that's where I think that, what's there, what's helped there, if training's proper, if you're getting trained at home, if the support's there, are you going to have faster or better development for your child? So thesis statement. So active parental involvement in a structured autism therapy significantly improves the child's communication, social relationships, and emotional regulation, but only when it's supported by proper training and resources is basically the outcome. So that's let alone, clinical therapy does support. I see a value there. But if there's no support at home, then it actually can do a disservice. So there needs to be that proper training, I think, at home with the parents to help both sides of it. So some of the supporting research did show, so strongly supports parent involvement. There was a Laurent and Gorman that I found a study, for example, that they showed parents actively guide their children by labeling emotions, modeling the appropriate responses, and the child improves emotional regulation and communication. So the child sees the parent at home most of the time, right? So they learn from the parent. That your child always, watches their parents, and learns from them. That's how they are raised, and that's what all they know, right? Outside of the home setting and different clinical settings. So parents are their primary role models, right? When they respond calmly, you're consistent to the child. They begin to mirror, and mimic those behaviors. So you see growth. So this shows that learning doesn't just happen in therapy sessions; it continues to the home, everyday practices. There's other supporting research. Mullen and colleagues studied at home-based programs and found improvements in emotional regulation and reductions in behavioral challenges. So with the instructional stuff in this clinical setting is taught to the parent, and it's practiced at home. It's both, so it's positive on both sides. Child learns faster. There's the reducing stress. for both parties, right? The child's less stressed, the parent is less stressed and is capable of taking care of the child, and it's supported there. So consistent finding when parents are trained and engaged, children show measurable progress. This is documented and these two studies. And there's another program that they used in this one. It's CPRT, so child parent relationship therapy. So teaches skills like reflective listening, child-led play. The parent can work with their child and develop different learning habits and play structured and can reduce stress basically for both parties, because it can be tough sometimes of their how they learn and understand and can communicate, right? So it helps with those behavioral issues. There's some opposite, right? Not supporting things that show that those Chang and colleagues had found that high stress level in parents linked to increased behavioral problems in children, including anxiety and aggression. So this highlights that the quality involvement matters more than just an involvement itself. So it kind of goes to show you, like, if there is like a high stress at home, in the family life of the child, that it's a disservice. Like, it's actually doing, it's regression. Like, there's any type of progress that's being done is of course helpful in a clinical setting, but the home is very important for a child's development and can actually go backwards. So opposing research there that shows, that could be a disservice if the home is tough. So other research points to external environments. Example, there's structured preschool programs with trained professionals sometimes produce stronger outcomes than untrained parental involvement. And it keeps to show you that, hey, even if there's not that it's not stress, but if there's properly trained schools and development and procedures that, it works out better than something that even could be positive at home. It's really important to get the school systems and clinical settings and involvements with trained people in this segment to help with children's development. It shows positive signs. So parental involvement must be supported by professional guidance and strong external systems, alluding to that. Implications. So the research has several important real-world implications. First, the parent training should be a standard part of autism therapy. I think that should be in every type of setting, should have the child or the parents involved, right? So that should be a clinical setting part of it. There should be, meeting with their therapy, doing sessions with them, and then creating a at-home plan weekly and daily, kind of to progress that. So collaboration between the parents and professionals is essential here. So when therapists and educators and parents work together, it's dual services for the child. Like, you get two support systems across the environment, right? It shows significant growth and support. And I think from being a single parent, the real important thing is the struggles, and because parents are busy with work, busy with everything going on in their life and everyday stresses and finances and everything else. And that level of stress can really hinder a child's development, I think, because stress can really, play a bad part here. And if the parent can understand how to work through those and has planning themselves, the child wins. So just personal reflection on on my post is working on it. It just gave me a deeper understanding of the struggles that parents have with children with ASD, and how how many more are coming. It's not uncommon now, right? And a parent myself, I realized, learn everyday behaviors and reactions. I actually learned to some of these things with my own child, reducing my stress load, staying organized and planned with him. He does not have ASD, I said, but he is high functioning, and he does provide a lot of, with every situation, a lot of instruction, training, and just keeping him on a segment. And big part of this is consistency. I've known with kids is being very consistent on the same day and week and building them, and that gives them structure. So, and it, and understanding this is just helping myself develop, like the impact of stress and what it causes in families. So, So conclusion, parental involvement plays a powerful role here. And social development with children with ASD, we understood that. So the research clearly shows that when parents are involved, properly trained, then it definitely supports a clinical setting of both sides. But it also shows that the involvement can't alone carry anything, right? So there needs to be a clinical setting. We need to be there need to be help and trained with specialists to help develop that plan, because you can't just be at home and do the best you can or as much research you can find. We really need professionals there. Parents need proper training, right? They need emotional support. They need a collaboration with the clinical part and professionals to see solid growth here. So moving forward, there should be a greater focus on family-centered therapy models that integrate the parents and the treatment process. Like I said before, I think it's very important that they get all the support they can, because this isn't, it's not like something that's going away. I think you've seen the impacts and the numbers increasing all the time. So doing this, I think you'll have better outcomes for our children. They'll grow and have a better life and become adults and have have everything that they need to you know to be out and create relationships and be able to speak better and communicate better with others. So yeah, it was a great class, great research paper. It was great to learn all these different studies and the support there. So thank you very much.